We do have a quorum, I believe. Yes.
Yes.
Okay.
By the skin of our teeth.
Yes, we do. The Finance Committee meeting.
Call the Finance Committee. Once I turn my microphone on. Good morning, everyone. We're going to call the Finance Committee meeting to order at this time. Any questions, concerns? At this time, I adjourn the Finance Committee meeting.
Well, we need to get a motion to approve the.
Oh, I forgot. I have one action item that does need to be approved. Can I get an approval?
Move to approve.
Can I get a second? At this time, we'll adjourn.
My microphone on. So I'd like to call the Juvenile Welfare Board meeting to order. First order of business is to welcome our latest member to the Juvenile Welfare Board, Commissioner Lafala. We really look forward to having you join us and participating, as we know you have had a focus on children for your entire life. And we expect to see a lot of great things from your support and a lot of good direction. With that, would you lead us in the Pledge of Allegiance?
I pledge allegiance
To the flag
of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so let me switch places a little bit here, and for a special award, the GFOA Award. For the third year in a row, JWB's accounting team was awarded the GFOA's Certificate of Achievement for Financial Reporting. This was for the FY21 JWB Annual Comprehensive Financial Report, which you can find on our website on the Budget and Financial page. Last year was the third time ever receiving this award, which is considered the gold star in financial reporting. The GFOA, or Government Financial Officers Association, established a Certificate of Achievement for Excellence in the Financial Reporting Program in 1945 to encourage and assist states and local governments to go beyond the minimum requirements of generally accepted accounting principles. It encourages the preparation of annual comprehensive financial reports that evidence the spirit of transparency, full disclosure, and then recognizes individual governments like ours that succeed in achieving that goal. Please join me in congratulating the accounting department, led by Senior Manager Lynn Delatorre, her team, Richard Godfrey, Senior Accountant Ann Crawford, Accountant, and Julia, and I apologize, Plentive as a fiscal specialist. Would you please like to join me here?
Thank you.
Congratulations.
Thank you. Thank you. Ready? 3, 2, 1.
Thank you. Thank you.
Would you like to say anything?
Really just to thank the team. Without Lily or Richard and Ann, it wouldn't be possible. They're just a great team to work with, and I really appreciate them. Thank you. And also Laura Brock for her leadership. Sorry.
Once again, thank you. Okay, having in front of you the consent agenda, or consent items. I assume everyone has had an opportunity to review them. Do I have a motion to approve?
So moved.
Second.
I have a motion and a second. All in favor, say aye.
Aye.
Those opposed, same sign. Motion's approved. Action item A, update on children's mental health initiatives and approve new position to support expansion. Rebecca?
Good morning. I'm Becky Albert, Senior Manager for Strategic Initiatives here at JWB. Today, I will be presenting with Dr. Jennifer Katzenstein, who is the Director of Psychology, Neuropsychology, and Social Work for Johns Hopkins All Children's Hospital. Dr. Katzenstein also chairs the Children's Mental Health Initiative Workforce Design Team. So after hearing about recent trends and how the pediatric hospital is responding, she will outline the most pressing areas that our design team has prioritized in order to address the ongoing need for an engaged and skilled workforce. If you can believe, it'll be 5 years this May from when JWB convened a group of partners which led to the development of a shared vision for children's mental health. About a year later, in August of 2019, we entered into an agreement with Evra Health to integrate behavioral health and support services into its pediatric practices. 2 years after that, October of 21, we added a second entity, North Pinellas Children's Medical Center, which some of you may recall attending the ribbon cutting ceremony. Which brings us to the present day, where I'll be sharing 3 years of data consisting of the initial implementation of the integration of services within Evra Health, combined with the first year of integration from North Pinellas Children's Medical Center. So just a quick refresher that the integration of services within pediatric practices is both clinical and non-clinical staff. Often this team of professionals are tasked with various activities that are patient and family-centered. They're practical, effective at helping children from a prevention and early intervention perspective. So highlights from year 3. Well, the big win, in my opinion, for our community was executing an agreement with North Pinellas Children's Medical Center and having Evra Health support to guide the process based on lessons that they had already learned. So last year, in year 3, more than 6,600 children were screened for adverse childhood experiences. More than 1,500 children were supported through care coordination, meaning that they were linked to a referral or a service within or outside of the pediatric practice, and staff were monitoring the referral until the actual linkage or connection occurred. Nearly 1,400 children had one or more visit with an integrated therapist. And what I think that we really need to be paying close attention to, which I've circled there on the slide, is that by having an integrated team within pediatric practices, nearly 500 same-day crisis interventions occurred. So one of the most significant enhancements to our system has been the ability to provide same-day services. In particular, same-day crisis interventions, which are often initiated by the pediatricians for situations that need more of an immediate response. Situations ranging from a child exhibiting concerning behaviors to parenting challenges related to age-appropriate consequences, for example. Situations that, if ignored, may have resulted in the need for deeper end services. So the number of appointments and visits continue to increase year after year. And with more than 4,600 visits occurring with integrated therapists within the pediatric setting, just as a reminder, in year 1, we were just starting to take off. We had recruited and hired staff, we were training, getting in place, and then boom, the pandemic arrives. It created a lot of unanticipated challenges, and so that is life, right? But we began to pivot, and so in year 2, Evra Health began developing the infrastructure that was needed to to provide telehealth services. And meanwhile, people were getting sick, offices were closed, and there was a heightened anxiety due to this unfamiliar space that many of us found ourselves in. However, our partners continued to adapt and moved forward. And in year 3, we were adjusting now to the new norm. Families were learning that there was a support system available to them within the pediatric practice. And with the number of same-day visits growing, We had a 30% increase in year 3 of same-day visits when you compare it to the year prior in year 2. But obviously, even with an increased availability to behavioral health services, barriers extend beyond the scheduled appointment. With our engagement rate at 57%, the team has been working on improvements, including reducing the wait time for a scheduled appointment. They're automating appointment reminders, and they're utilizing the motivational interviewing when connecting with patients so that they can better understand some of the common barriers that present with their patient population and help to remove them. Nationally, the literature reports a no-show rate between 30 and 60% on average for behavioral services, but keep in mind that this is really dependent upon the demographics and socioeconomic status. Next slide, please. Thank you. So part of our ongoing quality improvement is continuing to understand what difference we are making. Specifically, are children better off? This initiative has really allowed for accessible real-time support. And for the most part, we've maintained a workforce that is continuing to develop relationships and respond to the needs of the pediatric population. We're continuing to work on reframing what mental health actually is so that when stressful events happen, children know how to respond. Because no one is immune to hardship. We're really placing an emphasis on changing the way people think about mental health. We're helping children to develop the skills so that they're able to bounce back. At the end of the day, it's about ensuring that kids feel safe, supported, and know how to ask for help when times get tough. But with this being said, there are many opportunities ahead. And so now I'm going to turn it over to Dr. Jennifer Katzenstein to discuss recent trends.
Thank you. Thanks so much for having me here today as well. Integrated behavioral health care into the primary care setting is one opportunity for us to be able to really improve the mental health of our children and our adolescents as they move towards adulthood. However, we have to provide the full continuum of care. We can go on to the next slide. Thank you. And so with that in mind, Johns Hopkins All Children's has been working to develop that continuum of care beyond the fantastic work that JWB has been able to put in place and providing evidence-based care in terms of motivational interviewing for those children and adolescents in that integrated behavioral health setting. But we need to provide that full continuum, and we need to ensure that the therapists, the counselors, the psychologists working with our children and adolescents are well-trained and have evidence-based treatments that we know provide a shorter time in care, better outcomes of care, and actual cost effectiveness as well. So what are we seeing at Johns Hopkins All Children's? Interestingly, in calendar year 2021 to 2022, we saw a doubling in the number of Baker Acts presenting to our emergency room. I don't know what happened last month either, but last month was our highest number of suicide risk assessments in our emergency center that we've ever had on record. And it's the shortest month of the year. So that was, it was straining our system, but it was also straining our workforce. And we are not a Baker Act receiving facility. So when these children and adolescents present to us, it is then our goal to be able to place them at a Baker Act receiving facility. However, there's few beds in our county, and we're often looking outside of the county and across the state for placement. So what is the result you see here in calendar year 21? We had a 67% rate of placement within 24 hours. And as you know, the Baker Act stays in place for 72 hours, and so approximately 17% remain with us for greater than 48 to 72 hours while we're still looking for placement in an accepting facility. And that's oftentimes a barrier because our accepting facilities in the area and around the state already have their own waiting rooms full of patients that they're trying to get in first. And so they're going to serve the patients right in front of them before we transport someone to them. In addition to that, beyond that crisis situation of having suicidal ideation or a suicide attempt, we've seen increased anxiety, depression, eating disorders, and substance abuse. We've seen a tripling in the number of eating disorders patients over the past year coming to us, and again, looking for appropriate care and treatment on that continuum of care. So what do we know? We've done a fantastic job with that integration into behavioral health. As Rebecca mentioned, having that great opportunity for access. Same-day appointments is unheard of in many areas across the country, so to be commended for that. But we still need to work on that full continuum of care and ensure that we have a well-trained workforce in the community that meets the needs of our community and our children and adolescents when they have concerns that require that next level of care, potentially more intensive outpatient services, all the way up into thinking about inpatient care as well. Next slide, thank you. And so what has that response been for us at Johns Hopkins All Children's? And I'm so grateful to Rebecca and JWB for hearing me out on this as we've talked about workforce training. In May of 2020, much when many of us were undergoing changes with the pandemic, I was put over our social work department at Johns Hopkins All Children's, which is 36 social workers who provide care for our inpatient and outpatient settings. And I'm a psychologist by training, and we had brought them into the psychology and neuropsychology department with the expectation that they would have evidence-based training under their belts. And it became very clear as we were in conversation together that they were concerned about their own level of training. They had 2 years in a master's program with some great care, but really broad expectations because social workers hold so many roles. And they had a significant interest in getting more evidence-based training certifications, supports, and opportunities to be able to expand their skill set and in turn provide better care for our kids. So right away, we had 3 in place: motivational interviewing, which we've also had the opportunity to expand to our integrated care partners, ACT, and then radically oriented CBT, which is a specific evidence-based treatment for eating disorders because we were seeing such a need. We've also included the opportunity to expand our training opportunities for those in graduate school, so they're getting that very intensive behavioral health intervention as part of their practicum experiences. And really what we were starting to see, because many of our social workers are recruited from the local community, they were hungry for more evidence-based training. They were hungry for further certifications. And again, these are all things that benefit us in the long term, because what we know from the research is only 10% of our kids who enter into outpatient therapy will receive an evidence-based intervention. And then again, we know that that evidence-based intervention has more positive outcomes than the traditional laying on the couch therapy interaction that people often ask me if they can come lay on my couch and do. You're always welcome to come lay on my couch and take a nap, but we're not going to do therapy that way. You can go right on to the next slide. So again, I'm so grateful for the opportunity to be here. I'm going to turn it back over to Becky so that she can continue on to our next slides.
So we've really gotten started with offering some evidence-based training to both clinical and non-clinical staff. The motivational interviewing, for example, reached nearly 1,000 professionals. I myself sat through the 11 trainings that we hosted. People say, oh, Becky, aren't you an expert now at motivational interviewing? But the reality is that unless you're using it and you're having the opportunities to be supported by someone who is an expert and you're continuing, it's a behavioral change. And so it's very important that when we talk about and think about trainings, it's not a one and done. You're not going to be able to carry forward the skill set that is needed, especially today, and the way that we need to respond to our children with just a single training. And so we really want to put a focus and an emphasis on developing the workforce, both clinically and non-clinically. When we think about all of the programs that JWB funds, out of school time, for example, we've been getting an influx of calls from funded and non-funded programs saying, we don't know how to respond to the behaviors that we're seeing at our centers. What can we do? So it's very important that we continue to be intentional about the trainings, but move beyond that, the one and done, because it doesn't really work like that. We want to become more trauma responsive to our community. So as we continue partnering with the major collaboratives, key governmental and non-for-profit entities as it relates to community health, it's important that you know that we're also working with several smaller entities that JWB does not fund. For example, New Vision Behavioral Health, St. Pete Youth Farm, Speak Up for Mental Health, and the City of Pinellas Parks and Rec. Those are just a couple of examples. And why this is important, it's because these individuals have a similar message as us, and they're beginning to carry our key messaging, the universal messaging and educational materials to the places that they're involved with. And it's really about the relationship at the end of the day. And so our reach is growing. I think beyond what people even realize. At the state level, we're leading efforts to explore the feasibility of reviewing all child death by suicide, and it's not a problem isolated to Pinellas County, but across our state and nationally. So while we've made significant gains in terms of integrating behavioral health, we have, I mean, it's a remarkable advancement from where we were 5 years ago. In fact, people are turning to us. They're contacting us from Palm Beach County to Maryland and beyond. They're looking to us to provide technical assistance based on the work that we've done locally. The integration is one piece. But we continue to be very active in other spaces, increasing engagement with children and families out in the community. However, we are at capacity internally here at JWB, and so in order to move this initiative forward, it is my hope that the board will approve the addition of a position here at JWB to support the continuation, expansion, and elevation of this initiative for children in Pinellas County.
Any comments or questions? Yes, Brian?
Yeah, thanks, Mike, and thank you guys so much. This is really awesome, like really excellent work, and obviously definitely something we want to continue to support. I did have a question for the doctor regarding, the fact that, Johns Hopkins is not a Baker Act receiving facility, yet you still get, a tremendous amount of Baker Acts. And I know, from my work as an attorney that child Baker Acts is a huge problem because they just get bounced, and then they're not getting the treatment they're supposed to get, and then they're held for days and days and days longer. I mean, is there anything, I don't know how to solve this or what we can do to help with that part of it. And I mean, is there a problem where people are bringing children that should not be brought, that should go to St. Anthony's or go somewhere else to you guys? Is it an education thing for law enforcement or EMS, or is it just the parents that don't know any better?
Everything you just listed.
Okay.
So it's a number of levels. We have great relationships actually with our St. Pete PD training, and have been able, we have a psychologist who's embedded in their CIT training for our St. Pete Police Department, and also who does the autism training. So we've been able to provide a lot more resources there for understanding of what our Baker Act receiving facilities are. However, we have very few beds in our county. We had a consulting group come in, and we're about 250 beds short for children and adolescents in our 13 county area that Johns Hopkins Children serves. So when we think about the continuum, sometimes I just wish I could throw my slides up for you. Prevention and early identification, as JWB has focused on, is the base of that pyramid. And really, Baker Acts and inpatient care is the height of that. But we have everything in between as well in terms of outpatient care, intensive outpatient, and PHP that needs to be built across the country, but in our area too, for those step-down services to avoid that bouncing around. Because right now you go to a Baker Act receiving facility, it could be in Tallahassee, it could be in Miami sometimes, because that's where we have to go with a bed. Wow. And then you come back and 1 hour a week isn't enough, right? We need to come back to intensive services. So one of our goals is to build that continuum of care with our community partners. But a key piece of all of that is having well-trained staff. And as I'm sure everyone in this room is experiencing, staffing and workforce is a huge concern right now. So if we can also provide that, interestingly for social work, many of our social workers pay for supervision hours in the community to be able to get licensed. We've started offering it for free. If you want to come in and you want to do great work, then we'll do all those hours for you for free and get you licensed. So everything you mentioned, to answer your question, is an area of concern. But people come to Johns Hopkins All Children's because our name's John Hopkins.
Sure, yeah.
And they think we should have everything,
Right.
and we're working to provide that. But again, ongoing challenges, and we could do a whole retreat on that for
I'm sure.
days.
So I guess in Pinellas, I know Meast and Eden has a adult or child
Yep.
Baker Act facility. Do any others?
And PIMS.
And PIMS.
That's it. Yeah.
Okay.
So St. Anthony's would be 18 and up only.
So yeah, they'd
Yeah,
be
we-
bounced anyway. So I guess one of the questions I have is, and this is probably a longer term goal, but I mean, if there's anything we can do, and I know we're just a small part of the funding piece, but if there's anything we can do or collaborate, try to pool funds with other, people
Amazing.
to try to provide some more beds.
Thank you.
I mean, that, it, just locally, so that these kids aren't getting bounced to other counties and then they're held for a week when they should be held for 2 days or 3 days. I mean, half of them aren't even getting seen by a psychologist and they're a psychiatrist, and then they want to just leave and they can't, you know, because they gotta get cleared and they're not. So,
And a lot of these kids too, again, I'm gonna take this opportunity, sorry. We have the opportunity for like a walk-in urgent care clinic too, where we could be able to meet the needs briefly. Maybe a lot of these kids, especially LEO Baker Acts, don't need to be Baker Acted. There's other things that we could have done to divert them from the Baker Act, but we still need that intensive level of service, which is the intermediate piece of that pyramid.
right. Well, anything we can do to help fund that issue, also, I'd be interested in.
Excellent.
Yeah,
Well,
just
careful.
clarification as well, Brian. Morton Plant has capabilities as well. Unfortunately, they're 18 and over. You know,
Yep.
that's the problem.
Yeah, so adult beds are easier. So
Yeah.
sometimes when an 18-year-old walks in, I'm like, yes, that's going to be a little easier. It's the child and adolescent that's really a challenge for our county, and we're going everywhere.
And St. Joe's as well.
St. Joe's has pediatric beds, but then that's out of county.
It's out of
right?
county.
Yep, or South Sarasota Memorial. Suncoast is the behavioral health facility south, and then we go everywhere. So we have transportation funds, so we'll transport to Fort Lauderdale, Miami, oftentimes to be able to get these kids care, but we should be able to provide it here.
And I'm sure, as Brian has mentioned, as the board, we would welcome to hear more about any other opportunities that might make sense, where we could support and work with others to help make it happen.
Thank you.
Thank you.
Thank you so much.
Are there any other questions or comments? Okay. Then let's move on to,
Do we need to vote?
we have an action item. I don't see it.
Move to approve item
Okay, we
4A.
don't even worry about it. Didn't even see that there, but we have the action item. Yes,
Yes,
Susan?
I'll second that motion.
Okay, so we have a motion and second. All in favor? You've got your position. Okay, let's move on to accepting the FY '22 audit and financial statements. Cheryl Becker, or Sherry Becker? Lauren?
Hi, good morning. My name is Lauren Strope, and I had the pleasure of serving as the audit partner on the audit of Juvenile Welfare Board for the fiscal year ended September 30th of 2022. Today, I'm going to take you through a brief presentation to talk through the nature, the extent, and the timing of our audit. We did have an in-depth meeting with the Finance Committee earlier as well. So again, we have completed our audit and we're ready to render our opinion after your approval today, and we are ready to issue an unmodified opinion on your financial statements. That's a clean opinion. It used to be called an unqualified opinion, but it's the highest level of assurance that we as your external auditor can provide to you. It's a good, clean opinion and the only type that you want. We actually use a variety of different auditing standards when we complete this audit. The first is generally accepted auditing standards, which does require us to plan, perform our audit, and express an opinion at the end. Because you are a government, we also follow government auditing standards, and that does require us to look at financial controls over, internal controls over financial reporting. We don't actually opine on that, but if we became aware of any significant deficiency or material weakness, that would be noted in our report. You have a no comment report this year, which is a clean one, which means that we did not have any significant deficiencies or material weaknesses in internal control. So again, the highest level of assurance, a good report, and the only kind you want. We also follow Chapter 10.550 Rules of the Auditor General of the State of Florida, and that does require us to issue a management letter, which will be the second to the last report in your financial statements. The final report that we issue is required by the state of Florida, and it's an examination over your compliance with investment policies here in the state of Florida. That, again, is a clean or no comment opinion. So in all cases, you have great opinions all the way around. You also did, as was presented before, receive the GFOA Certificate of Excellence for your 2021 ACFR, and that is included in the report. As it relates to the qualitative aspects of accounting practices, all of your significant accounting policies are disclosed in Note 2 to the financial statements. So that kind of takes you through how everything is accounted for. This year you did adopt a new standard. That was GASB 87 related to leases. The only lease that you had that really rose to the level of the standard was already recorded on your financials as a capital lease. So it simply changed some of the wording in that footnote as opposed to bringing something new onto the balance sheet. Related party transactions and relationships are something that we spend time on, and we did not know any that were not properly disclosed to us or discussed with us when we started the engagement. As far as significant or unusual transactions are concerned, that's very particular to every single entity that we audit. So JWB did not have any transactions that we deemed to be unusual or significant as it relates to the operations of JWB. The financial statements are not all just hard numbers. Inherently, generally accepted accounting policy practices requires that management put a lot of estimate and judgment into the financial statement preparation. And we as auditors spend the majority of our time, as you can imagine, looking at those estimates and judgments to make sure that they're fair in relation to the financials as a whole. You can see listed some of the significant ones that we saw, like the allowance for doubtful accounts, the estimate of useful lives of your capital assets, which impacts your depreciation expense, OPEB and pension, which relates to your actuarial calculations. Again, all of your significant accounting policies are disclosed in footnote 2 of the financial statements, and we did not see anything that was not neutral, consistent, and clear, and again, in line with both prior years and with industry policy. Just some upcoming financial reporting changes for you. So last year we had leases and that was adopted. Upcoming you have GASB 96, which is the subscription-based IT technology arrangements. So 87 kind of scoped that out, and these are all the types of cloud-based subscription services that you might be paying for. In the past, those have always been treated as operating costs, but just like the leases, they might be coming on the balance sheet for next year. So we will be working with management as it relates to that. There's some other upcoming GASBs that may or may not have an impact, but the subscription IT-based one most likely will. So again, we will work with management about that, but I just wanted you to hear it before we come back next year and present on it. And with that, I am happy to answer any questions that you have. I did want to mention that, as always, it was a pleasure to work with management. Every time we asked for something, they made sure we got it. Every time we needed something, they made sure that we had it in a timely fashion. So we definitely appreciate working with them. And again, I would take any questions you might have.
Are there any questions? Sue?
I'd just like to comment that the Finance Committee had a very thorough report on the audit, comprehensive report, and I just want to make note of that, that today is a summarized version, but we did spend quite a bit of time at the last finance meeting. Thank you.
Any other comments or questions? Do I have a motion to approve?
So moved.
Second.
I have a motion and second. All in favor, say aye.
Aye.
Those opposed, same sign. Motion's approved. Thank you again. I'm glad you're feeling better.
Thank you so much. I appreciate that.
Okay, moving on to the award, approval for award of workforce stabilization. Karen?
Good morning, Karen Bogus, Chief Program Officer here at JWB. And this is the last installment. I've been up here several times over the last year and a half talking about the workforce stabilization, the importance of us stabilizing the provider's workforce and recruitment and retention, and all the challenges that have come forth, that if we don't have a stabilized workforce, children and families are not receiving consistent quality programming. So this morning I am here to ask for approval for the last 8 programs that were to receive workforce stabilization funding. The attachment to the memo includes all of the programs and their amounts for this year, as well as their annualized amounts. I'm going to read for you the action that staff are recommending the board approve budget amendments for the final 8 programs under consideration, with a total recommendation of $575,703 for this fiscal year 23, and annualized $1,064,469 for fiscal year 24. And both of those are under the budget amount for fiscal year 23, as well as the projected amount we had for fiscal year 24. I'd like to open up for any questions.
Any questions? Seeing none, do I have a motion to approve?
Motion to approve.
I have a motion and a second. All in favor, say aye. Aye.
Thank
Those
you.
opposed, same sign. Karen, that was an easy one.
Thank you.
And I've had the opportunity over the last few months to go with Karen to each of the NFCs. Major topic at every one of the NFCs about workforce stabilization, their needs, their wants. Karen's been able to handle that extremely well. So, but it's good to see that we're making progress. Thank you. Okay, moving on to approval of the South County Community Council appointment. Kelly?
Sorry, never done this. Good morning. My name is Kelly. I'm the Community Engagement Advocate for South County. And it is my pleasure to introduce you to Miss Nikisha Wright Sutton for your consideration for South County Community Council. Miss Nikisha is a proud mother of a 4-year-old boy. She's a passionate advocate for children and pregnant women. She's worked in the health field as a dialysis technician for 15 years. In July of 2020, she made a career change, and she's currently working as a prevention and outreach specialist for TAPWA, which is targeted outreach for pregnant women, a program at Epic Empath Health. When she's not working with women to access prenatal care, she's currently working on getting her degree in health sciences. I believe she's going to be a great addition to South County, and I appreciate your consideration.
Any comments or questions?
Sounds like you're going to be a wonderful addition.
Thank you for your service and your willingness to serve. Thank you.
Okay, so do I have a motion to
A
approve?
motion to approve.
Second.
I have a motion and a second. All in favor, say aye.
Aye.
Welcome to the South County. All right, moving on. Chief Executive Officer's report.
Very good. Well, first wanted to report in on a wonderful event that we had here, our Legacy Leadership Circle, where we invited past board members to come and engage with us and hear a little bit about the work that we're doing currently. And you'll see some pictures on the screen of that day. So with 75 years behind us, it was the perfect time to lean on our leadership from the past and gather our former board members for this very special event, hosted here on February 10th. Board Chair McCurrick and Public Policy Director Becca Teeter and myself were the hosts. A dozen former board members joined us that morning, swapping stories about their time and their service on the board, frankly, just enjoying each other's company. They visited displays of our initiatives and our campaigns, which once we got out, we decided to keep in the hallways. And they took part in a robust program with a very lofty goal of filling them in an incredibly short period of time. So we covered 8 topics in 1 hour. So sort of like a speed dating version of finding out about what JWB is doing. It was presented by JWB leadership and also many of our wonderful staff members to highlight the work and accomplishment of today's JWB. So our legacy leadership was, the group were really riveted, engaged, and asked a lot of wonderful questions. Another highlight for the group was posing in front of the JWB Board Legacy plaque where their names and years of service are engraved. So there we start with Mike, and you see Judge Gross, Martha Linderman, Dr. Jim Sewell, County Commissioner Barbara Sheen Todd, Angela Roussan, Janet Caramello, Judge Frank Caseta, Judge Walt Logan, Cecilia Burke, Judge Marion Fleming, and Judge George Greer, who was actually a county commissioner when he was on this board. So over the coming months, we'll be circling back with each of these to determine their level of interest for future engagement. But it is certainly an event we hope to repeat in the future, and was a great way to stay in touch with some wonderful folks. Wanted to let you know, you may have picked up in the newspaper or otherwise that DCF has made the decision to take back child protective investigations from the 7 sheriff's offices within the state that currently perform that function. So the Florida DCF Secretary Siobhan Harris recently sent letters to these sheriff's offices citing an evolving child welfare system as necessitating the change. That does, Pinellas County is one of those. Actually, Pasco and Hillsborough County are two others of those 7. So over the coming months, DCF will work with the Florida legislature to formulate a plan that ensures as smooth a transition as possible, including opportunities for CPI staff who are currently with sheriff's departments to transition to DCF to ensure continuity of services. Since the late 1990s, Child Protective Services have been overseen by sheriff's offices in these 7 Florida counties: Broward, Hillsborough, Manatee, Pasco, Pinellas, Seminole, and Walton. It was started as a pilot and with the thought that it might go statewide, but ultimately it did not, and those 7 counties are the only ones who have operated in this manner with the sheriff's office responsible. So each of those sheriff's departments have maintained their own child protective division, staffed with civilian investigators to investigate cases of child abuse or neglect. The initial plan was to expand statewide, but as I said, that didn't ultimately happen. So we had two different things going on across the state. Our own Pinellas Sheriff Bob Galtieri was recently quoted as saying, "What was the right thing and a good thing 25 years ago is not the best model for effective child welfare in Florida in 2023. It really is a state responsibility, not a local level responsibility. It just makes good sense." Sheriff Galtieri noted that having one entity in charge of all child welfare investigations might help with the sharing of resources and personnel across Florida. If there's a shortage of investigators in one county, there's the possibility that personnel could be moved there from other counties, from another part of the state. When this topic was discussed at the recent Pinellas Community Alliance meeting, it was stressed this is absolutely not in response to any performance issues with either our sheriff's office or any of the other sheriff's offices. I'd have to I think I ought to take a breath and just say how much we have appreciated the professionalism and the commitment that Sheriff Galtieri has made and his group has made with child protective investigations within Pinellas County. And as all transitions are, you know, there are bumpy steps to transitions, and I think we can all expect that. Now, as that relates to the Juvenile Welfare Board, as our board members know, our services stop at the door of the child welfare system. We are not responsible for the child welfare system. We are meticulous about not crossing that line where state funds are there for the child welfare system. But we do work in significant ways in prevention, and we obviously keep an eye on the child welfare system as one of the key systems in the state outside of the work that we do that's incredibly important to our children. On a little bit lighter or maybe more positive note, earlier this week, the selection committee for this year's Dillinger-McCabe Putting Children First Leadership Award met to review nominations. And the committee is comprised of our board chair, Mike McCurrick, immediate past board chair, Susan Ralston, former board member, Jim Sewell, and Bob Dillinger and Denise McCabe, who represent each of the awards namesakes. I am told it was a very difficult task, choosing just one from a pool of over 40 nominations, but that there was a consensus. And if you haven't picked up by now, they keep this very secret and they don't tell me, which is absolutely fine. So I will be as delightfully surprised at the event as everyone else. So that top-ranked individual will be kept a surprise until the announcement at the close of the Kids First Awards luncheon. That luncheon is on April 28th, 11:30 to 1 at the Coliseum in St. Petersburg, and I hope, as in years past, we will see you there. Each of you should have received an email from staff inviting you to serve on the honorary host committee for the event and inviting others to your table. And invitations to the public will go out in the coming weeks. So that's all I have for you today, unless you have any questions of any type for me.
Okay. Would concur. It is a secret. But it was a unanimous decision, which I thought was extremely well taken, and it was a difficult one because of the number of people that and the services that were provided amongst this group. So we're looking forward to it, and hopefully it stays a secret until the day. Okay, moving on to the information items. Do I have any comments, questions on information items from any of the board members? Seeing none. Open agenda, do we have any? I do not have any cards. You have no cards? Okay, then moving on to anniversaries. Beth?
We have two staff anniversaries this month, two of our amazing employees. Janina Avoli has been with us for 31 years, and Jomar Lopez has been with us for 3 years.
Okay, well, as you, on your agenda, you'll see the future meetings that are coming up, and assuming or not seeing any other business to be had at this meeting, I'll call this meeting adjourned.